points I want to make today, really. One is to think about leadership, and I don't mean necessarily to be a CEO or a division chief, but to think about your role as leaders. And then secondly, to just share with you some research that we found, because I think it might help you in your careers. So that's really what I want to do. So I'm going to get kind of right into the study after some introductory remarks about leadership for physicians in general. So those of you who are medical students, do you plan to go into surgery, or have you been matched already into surgery? No, do you have interest in surgery? Okay, all right. So why in the world do surgeons care about leadership? And I spent about 5 years of my life specifically working on this topic. And part of it is that your careers, even though they may seem like when you meet someone like Dr. Ye, or there's all these different paths that people have taken, compared to other industries, it's pretty straightforward what you have to do. I mean, you know the order you have to go in, right? And if you're a physician, medical school residency fellowship, if you're someone who's getting their PhD, you have undergraduate, graduate school, postdoc is kind of the way that you go. And most of the time, your learning is happening in a clinical setting. Most of the time, you're learning inside, to be a clinician. And many times, and our experience at the University of Michigan is many times physicians become what we would call leading physicians. They, become an attending faculty, one of the panelists said, do you want to be the president of the American College of Surgeons, or, do you want to, grow into those ways? So many times people become leaders, become division chiefs, but they don't really have a lot of the skills that they need to lead. They don't often know, how much of your training has been about some of these words? About ACOs, or pay for performance, or healthcare reform. I bet you get a little bit, but not a whole lot. And then there's a little bit of a reputation that in particular, sometimes surgeons are not the best communicators. Physicians in general are not the best. That's a little bit of a reputation. A friend of mine who is a surgeon found this slide, but there's a little bit of, hey, there's not, we don't know what we're doing. So I actually think the healthcare system or ecosystem that you're all going to practice in is very different even than what these women are practicing in right now. As you go in and you embark on your career, this is a picture from the Robert Wood Johnson Foundation, but look at that. In the top corner, the impact on outcomes of care, only 20% of it is coming from actual medical care. The rest is from stuff like the quality of the air that you breathe. Think about Flint, Michigan, and the water situation there. We take for granted that water is okay. Health behaviors, diet and exercise. And then things like, do you have a job? So these are all going to be important in ways that I think you all are aware of in terms of how they affect your patients, but I think that's going to create new opportunities to lead. So here's what I want to tell you. Again, I'm not a physician. I actually teach in our Masters of Science in Health Administration program here at UAB. You might not know this, but we're the #2 program in the country in US News and World Report. We have been doing this for a really long time. This is a picture from our department in the 60s. This is what the leadership of healthcare looks like. I'm telling you, these are the people who are now at senior positions in the field. In fact, we just had 500 people come to Birmingham up to the club to celebrate our department's 50th anniversary. So we've been graduating people who run hospitals. In fact, Will Fernandy, the CEO of this hospital, is a graduate of our program. This is classes 1 and 2. He graduated in class 9. But this is what they look like. Do you see something about them that's, is this what if you looked at the 1965 graduating residents at UAB in surgery, would they look pretty similar? Bet you there wouldn't have been a woman in the picture. I don't know though. She in fact was a student, because I had to ask. Because at Michigan, when I showed this picture, there were no women in the first class. And that would have been a secretary or someone in the picture. So here's what's scary. I am convinced that what we need in healthcare, I'm just going to tell you, is more women leaders and more leaders who are not white. And that's another entire lecture that I can give you. But Look at that. The workforce in hospitals, maybe you're not aware of this, I bet you are because you work in them. The workforce is more than 70% female. In US hospitals, actually, the number is 76% of their workforce is female. Across the US, more than 30% of patients are not white. Okay? Now look at that. You go all the way up to the top, only 24% of hospitals in the US have a female CEO, Chief Executive Officer. I don't know what that number should be. I don't know. But don't you think there's a little bit of a gap there? If you look at minorities, they don't even really report on the CEOs who are not white because the number is so small. But if you look at senior management positions in healthcare, only 12% of them are minorities. So we don't look like the populations we serve. This is the map of the United States. I don't know where you plan on practicing or where you want to do your training, but some of these women talked about it depends on your fellowship or your residency program. There are big differences. And you can see that the red is the lowest percentage of women hospital CEOs, and it's probably not surprising to you that there's more of that in the South, but this really does vary across the United States. And a friend of mine who's actually at Chapel Hill, where you came from, two of my colleagues have done research on women hospital CEOs, and they're paid less than men. So you hear these things on the news and you think, oh, it's not like that in healthcare. But it is like that in healthcare. So I'm here to say you're going to enter a world that might feel differently than you're used to entering, and you need to be able to succeed in that world, okay? Things are changing. This is our class right now that's graduating this year. A little bit different. In my mind, there's a lot of white faces, but there are more women, there are more minorities than 50 years ago. But it hasn't changed that much in the world. So this is a particular institution that I'm not going to tell you who it is because I don't have their permission. But in this institution, when you look at the leaders, this is a large academic medical center that many of you could go work in. If you look at all the leaders, this includes department heads, chiefs, nurse leaders, all the leaders. 62% of the leaders are women. Okay, that sounds pretty good. That seems like it's a good thing. If you go to the managers, the nurse supervisors, and team leaders, in fact, 73% of them are women. If then you go to the director level, you only see 62% women. But when you get to the executive level leadership, you see a very different picture. There's something happening between early career and the C-suite. When I say C-suite, you guys know what I mean, the executive suite, this chief executive officer, the chief nurse, chief operating officer. There's something happening in there. And I'm on a little bit of a mission to say, let's change what's happening in there. Let's make sure that we're doing everything we can to find out what's going on there. And that's what my research has been about. So the fact is, there's a pronounced lack of diversity in healthcare leadership. And I could give you tons and tons of data, but you know that percent of CEOs that are women, that hasn't changed in a decade, which is kind of scary to me. And where this plays out is they don't look like their patients. The people making the decisions don't look like the patients or the communities. They don't necessarily understand what those needs might be, or in fact how you overcome those needs. And then we also see it in the boardroom, so the hospital boards. So I think we need to be different. So let's get into that a little bit. So if you take nothing else away from me, you younger women in this room, you need to go out to this website that is called Women in the Workplace. And it's a combination of the woman who wrote Lean In, Cheryl Samford, and McKinsey, a large consulting firm. And they have studied women in the workforce of 300 firms around the country. And this is a nice picture of a pipeline. And it shows you how at the entry level, you've got 42% women in 2014 and 45% in 2016. But as you go to senior levels, it falls down. Like the number of applicants for jobs, the opportunities just fall away. For those of you looking at academic pipeline, this is how do you get to be an academic physician? Or how do you get to be a professor? You have to start with high school, college, grad school, medical school, residency, work, and teach. There's a huge tenure gap in the number of women and men who get tenure, and it hasn't changed in about 30 years. If you know someone who is a full professor who is black or Hispanic, there's only 5% of all full professors are black or Hispanic. And if you specifically look at women, if you look at faculty members in all fields, only 64% of them are women. Or I mean, only 64% of them are men. So it's not even close to this sort of half and half. So there's just this whole differential between the pipeline. And one of my favorite quotes, and this is from one of the books that I read, is that the pipeline empties into territory that women and people of color often experience as uninviting, unappealing, and unaccommodating. So we heard a little bit of that today. It's changing. It's rapidly changing. And I want to introduce this concept. How many of you have heard of this concept of implicit bias? Yes? Some of you have heard of this? I mean, these are two articles from JAMA and the American Journal of Public Health talking about it as related to race. I think what we should consider is there's also unconscious or implicit bias related to gender. And it may be even that patient that we were talking about before who thinks that you're the nurse because you're a woman. That isn't something, they're not evil. They're just, in their minds, men are doctors and women are nurses. And so this occurs with gender as well. Women are not leaders in people's minds. And so I think we have to root out this unconscious bias that we have ourselves and that our organizations have. Okay, so that's my background. Let's get into the study that we did and maybe give you some tips about how to succeed. So we were fortunately funded to do a study of women leaders in healthcare. And in this study, we asked 3 questions, basically trying to understand what happens for women who have become chief executive officers. What were the critical inflection points in their careers? Okay, so I actually heard many inflection points in this conversation here. I actually heard Dr. Ye mention, in my terminology, inflection points in her career. And so we wanted to understand if that varied for people who started out as clinicians, like you, or for people who started out with basically business degrees and ended up as hospital CEOs. And I think this model is from Powell, but I think it is interesting to think about all the factors that will play on you in your life, in your career, that are on all of our lives. I mean, clearly, on the right side of this, there are things about you. Where did you grow up? What is your past work experience? Someone today talked about Dr. Ye's pedigree, right? There's a whole bunch of decisions in her life that are her individual factors. There's also factors on the left-hand side. Where are you going to go work? This would be, what is your residency program like? What is your fellowship program like? What are organizations doing to enable you to succeed? Whatever your gender is, right? And then we can't forget there are societal factors. This is why I think we see this regional difference in the United States still. I think there are societal factors at work. Just like if some of you are in medical school here and you go do your residency in New York City or in California or in Iowa. I mean, you're going to have patients who are, view the world differently. And of course, there are all kinds of decisions that people make. And I think that's how we try to understand this. So it turns out when you study careers, there's a lot of different ways to look at it. And we wanted to look at this concept of an inflection point. That is a turning point. So thinking about a point in your career after which things were different. It could be after which things were worse. It could also be after which things were better. But most people, when they reflect on their career, can start to identify some really important turning points. The other concept that I want to introduce you today, and no one has used this word yet this morning, and it's something called a sponsor. It's a little bit different than a mentor. In fact, as you were talking, I was thinking some of yours were probably sponsors. But this notion that someone who has power in the industry or in the organization, who can help you come along, who can say, you know what, there's a job opening, I really think we should consider this person for that job. So a sponsor is a little bit different type of mentor. And those were some of the concepts that we wanted to understand. So we interviewed a bunch of women. I'm going to skip through this. We actually did a sampling where we tried to get across the whole country. And it was a qualitative study. Let me go back to this. You can see the age distribution. Every woman in our study had become a CEO, a chief executive officer. All right, so that was the criteria to be in the study. If you look at this, it turned out we had 25% that were in clinical, 10%, so 2 women were physicians, 8 had started in nursing. So I can't really generalize specifically about surgery because we didn't have enough people in it that had come from surgery. But, so here's what we found out. What were the critical inflection points? Starting with what we called pre-career, that would include residency, mid-career, in the C-suite, and then some of these women actually had gone bigger than that and were running healthcare systems. So this is the trajectory that we saw. So clearly in the pre-career, there was getting the degree and having a residency or fellowship. I mean, those are requirements, you couldn't go further without those. But many of these women said, I took on a high visibility project. Early on, I did something that was really special, and I didn't even realize when I volunteered for that it would drive my entire career. They talked about networking, but they also talked about mentors, and they started to talk about sponsors. Bill Smith was the reason that I even was considered for the next, level job that I needed to take. And incidentally, most women in our study all had men mentors and sponsors. There just aren't enough women in positions to mentor and sponsor, is one explanation. But so then in early career, you start to see this risk-taking. I didn't follow the safe path. I had a chance to do something completely different. I went outside of my lane. I volunteered for something that was just totally different. That started coming up. At this point, some of them actually got formal leadership training. If they were physicians or nurses, this is when they might have gotten a business degree or a master's in public health. And then as they got into the C-suite, for many women in our study, this was the first, they're all women in our study, but many of these women did not think they would ever be a CEO until they were in the executive suite. That was not on their list. They all claimed that every guy they knew said at the age of 20, I'm going to be a CEO. And or whatever young age, look at me, I'm going to be a CEO. I mean, we have students in our program who say, I'm going to be a CEO by the time I'm 40. Most of those people who say that happen to be men. There is sort of a difference in a philosophy of seeing that. I think some women think it, but they're not comfortable saying it. So, and it's interesting, that's when they started saying, oh, suddenly I realized, maybe I could do that, right? And then it went on from there. So I'm going to skip this slide, but this is what we found specifically for the people who started in business, okay, like in my type of program, Masters of Healthcare Administration. And you can see that the big things for them were doing a residency, because we have a residency training. For them, it was doing something in 2 different departments in the hospital or being seen as both operations and finance. But I want to focus on this slide, which is the clinicians in our group. Now, most of them were chief nursing officers, had come through nursing. But I want to point out this risk-taking was really important in the early part of their career. Not being afraid to do something different, not following sort of the path that everybody else was taking. Also, having a mentor in your area. Having someone in your area that is really in your corner and helping you think through how do you kind of grow up in this position. Now, many of them, at later points, go on to get master's degrees. I will tell you, over in my department across the street, in our executive program, about half the students are physicians. Many of them are residents here, actually, but some of them come across from around the country to get an administrative degree. They're at a certain point in their career and they realize they need a different set of knowledge, and that's happening all around the country. So let me summarize what I found and try to have you potentially think about, if I was a new careerist like you, what would I think about, okay? So, first of all, generally speaking, women, and this is held up in other studies besides ours, women don't have as much career planning as men. So days like this are really good. I think this is a great idea, that you're even thinking about your career. You don't do anything, you're just thinking about it. That bit about voice means actually saying, I'd like to be in a leadership position. The physician in the room said, what do you want to be? It's okay to say, I'd like to be leading in what I do. And I think that's important. We found that the family work issue varied across the career. And I actually hate the word balance. I think I share Sandra Wong's experience. I think balance is the wrong metaphor. And so, in other words, things that were important to them when their children were little were things that were different. And what I would like to say to all the people asking about the babies question or the family, my children are 16 and 20 right now, and I like to tell people they're very well adjusted, you know, and I pay for a lot of help. And, you know, my philosophy is throw some money at it, right? I mean, if you have some money, I don't have as much savings as my friends, but I was able to do my job and have career success, but that's my own story. We each have our own story. But there are different phases of it. And so a lot of the women in our study who became CEOs said, my kids were older. My husband stayed home. We actually commuted. The husband stayed with the kids in town A, and I commuted to city B, meaning flying, because I wanted to take the job. We think we're the first study to show women doing that. Women actually saying, I have set up a network at home, including my husband or partner or whatever, such that this is such an amazing career opportunity for me. We're going to do this as a family. And that is happening now. We also found, and this is just a cautionary tale, that people who had begun their careers as clinicians, who then moved into chief executive officer jobs, had a harder time in that transition. They weren't as prepared for what it took. Something that I want to say here, I don't know which slide it comes on, but more than a couple women in this study said the first time in their career that they experienced sexual, bias, about being a woman, first time it hit them was when they were CEO. So all along their career, they never would have thought it made a difference they were a woman. And suddenly they're in this sort of upper echelon, and they're the only girl. They were the only woman in that environment. And some of the other CEOs in town even didn't treat them the same way. So it's fascinating to us. We think we're one of the first studies to actually see that trend as well. That it doesn't happen all along the way. It happens when you finally make it into that level. So what can you do? Okay, you need to network. You probably have heard this over and over and over, but meet people outside of the organization that you're in. Actively participate in conferences and educational, and don't just go here's a paper and go home. Talk to the people around the country. That makes a difference. Think about broadening jobs that you can take on, roles that can be expanded beyond your current one. Here's what I tell young women in our programs. Recognize a sponsor when you have one. I've had young women leave an organization even though the CEO or someone in a very senior position was looking out for them and helping them navigate. And they said, well, this other place offered me more money. And they took a very short-term decision rather than understanding that in the long run, that sponsor could have probably helped them ascend more rapidly if they would. They just didn't even recognize that's what that person was doing. They didn't know that concept. Finally, and I hope as students and residents you get a chance to do this, but if there's ever an opportunity to get to know yourself better, I know you guys are thinking, when am I doing that? I don't even have time to sleep. But if someone says, we're doing a DISC assessment, or we're going to do a Hogan or a 360, do it. The more that you know yourself, your strengths, what you love to do, the easier it will be for you to navigate those decisions you're going to have later. So I think that's important. What did we find out about organizations? And I want to say this to you, this audience, because you're going to be choosing an organization. You're going to interview for residencies, right? I mean, do you get to go interview for residencies? Yes. You're going to visit places. That's my thought. But, so as you look at an organization, I know Dr. Gay talked about different places she looked at for jobs along the way. You need to find out, are there mentorship programs, formal or informal? I don't even think having a formal one means that it's better than not having one, but do people talk about mentors? You know, what can you see through that process? Are organizations doing succession planning? The reason I ask that is if you're doing succession planning, they're actually thinking about what I would call the human capital, the people who work there. I mean, that is something we saw in our study. There is a particular investor-owned hospital system that gives women very early in their career a coach. Coaches are massively expensive. I mean, they cost a lot of money to have a good executive coach. This organization gives every woman one. And I mean, they're paying a lot of money and they're investing in women leaders. And guess what? A whole bunch of their hospitals are run by women. So, and they think they're seeing better outcomes for the hospital, better performance. Do they do any sort of leadership development programming? Do they have a diversity strategy? Because diversity is a lot of different things. And then, do they have a women's group or some sort of internal network to support people? So if you were running an organization, maybe some of you up in the upper area run organizations, what can you do? You know, you have to say, I'm committed to this. And by this, I mean women and minorities and leadership equity that, you know, is important. In great organizations, they measure how well people develop other people. It's a question on your incentive compensation, right? Recruit from diverse pools. A lot of times we just recruit from who we know. Guess who we know? Who do you know? You end up knowing people who are just like you, right? And so if you're a white man, most of the people that you know are white men. That's just human nature. Support women and minority groups, and that's days like today are really important. So it turns out there is science. I guess I want to introduce you to this too. It turns out I'm a social scientist, so I study organizations. And it turns out there are best practices. Just like there are best ways to take care of a diabetic patient or to do a surgery, we know what the best practices are. And these are some. I'm not going to spend a whole lot of time talking about it, but there is a science to studying this. A study that was done in 2013, so that's a couple years old, right? It was probably done in 2012. It was published in 2013. This blows my mind, and I just want to let you know. They did a study, and they tried to understand, of all hospitals in the United States, what were the factors that were related to having satisfaction in work in the middle column for women, in being a loyal employee who's a woman. Like, I want to stay here. I want to have my career here. Look what the #1 factor was. We're still talking about sexual harassment in hospitals. Nurses are men still grab the butts of nurses and other women. I mean, it blows my mind. I have a daughter who's 20. She would say to me, Mom, no one does this anymore. This study, it's still happening. Hospitals and other companies still have to focus on a zero tolerance for sexual harassment. So what I say to young women that I talk to, just don't be surprised. I think women who are in your age group expect it not to be like this and then are sort of shocked. We actually had a student last year here in town. Someone who was here for a meeting told her the only way she was going to get ahead was to use her assets. And did she want to come to his room? This was last year. And he was a very successful hospital executive. And she was flabbergasted by this. She was in her 20s. She was maybe 28. She wasn't like 21. She just couldn't imagine that this crap, excuse my language, still happens. So we got to root this out, right? We have to not accept it as okay. Look what else, after you go past #1. We have to have women on committees. We have to put women on the board. We have to have a job that allows you to come and go so you can get children to daycare. So you can be, my son is a sophomore, he plays baseball. So I chose to live we pay way more for our house because it's in Homewood, but I can get to Homewood to watch him play baseball. But I'm also in a position to say I'm leaving at 4:15. If I'm not in a leadership position, who gets to leave at 4:15? So we have to think about how we structure our days and how we allow women to have that kind of flexibility if we want women to succeed. So when I was at Michigan, I just wanted to say I helped develop a leadership development program for surgeons. Fortunately, it's continued, and we set up an activity like this. Here at UAB, there's something called the Healthcare Leadership Academy that is a similar program. There's also a management certificate program. Many of the organizations where you're going to go work are going to have ways to develop you. Michigan in the second year added house officers to this program. Before it was just for faculty. So just be aware that there are things happening in different environments where you go that would help you develop as a leader. And I will tell you what it also created was an opportunity for people to sit in a room together and get to know each other, which is networking. It was an opportunity for the senior faculty to get to know junior faculty and residents who could, they could mentor. And they did a fair amount of 360-degree evaluations and coaching. So these things, I know you think, how can I add one more thing in my life? I would say be aware of them and consider. So this is a picture I took when I went to Prague. Turns out it's like good overcoming evil. That's what it means. I think that unfortunately, sometimes we eat our young. Sometimes we are so focused on our own career that we might not be bringing along that person behind us. And so I love this image, even though it looks like somebody's, so this is from that McKinsey study that I talked about, women in the workplace. So there's 5 questions that you should ask when you look at an organization. Where are the women in our talent pipeline? If you serve on a committee, if you're involved in selection. I gave this talk at Rush University Medical Center a couple weeks ago, it's actually been 2 months ago. A young woman came up to me. She said, I was in our interviews yesterday for a fellow. I'm not going to tell you what it wasn't even surgery. I'm not going to tell you what area, you might know these people. But she came up to me. She said, yesterday we were interviewing fellow applicants. Yesterday. And 2 of the men in the room made a comment about what one of the candidates was wearing. Another one made a comment about one of them's hair. Now, it wasn't a guy and what he was wearing, and it wasn't a guy's hair. She said, I'm flabbergasted. Turns out the hair was an African-American woman's hair. She said, I'm flabbergasted that in 2016, in Chicago, Illinois, at a top place, this crap is still going on. So that goes to number 4. Those people aren't bad people. They're not evil. They're not out to get women. They don't even realize they're doing it. This is the unconscious or implicit bias question. But she said, I wasn't sure what I should do. I wasn't sure what I should do. Right? And that's the challenge. I want you to not be unsure about what you should do. So number 1, where are the women? Number 2, are we helping women and minorities build skills? What are you learning and training? 3, do we look for sponsors along with role models? Okay? 4, are we rooting out implicit bias? Someone needs to say, it doesn't matter what she wore. It doesn't matter what her hair looks like. Will she be a good fellow? Are her skills strong? Right? Are his skills strong? And then, are you measuring what you're doing? I study high performance in healthcare. I study the best organizations in the country. There's about 100 hospitals that I would consider to be high performing. They measure everything. They measure everything. So they should be measuring their ability to recruit, to develop, to lead on that function. If you're a manager, if you run a lab, or you run a division, or a department. You got to get beyond what is called the likability penalty in this field, which is we like people who look just like us. You know, that if someone is different from you, you're less likely to like them. So you got to make sure you're not doing that. You got to evaluate women and men and minorities in the same way. A lot of the ways we evaluate people are actually skewed to support people who had the job 10 years ago, right? Guess what happens at work? Women get all the work, housework. Women clean the coffee machine. I see some nods in this room. Women get the coffee. Women, you know, all these women order the flowers for the person who had the baby. That, you know, you've got to say, you know, this time, let's go in a circle. Like, you know, let's take turns. And it's your turn to do that. Because otherwise it just happens. You got to make work work for parents. If you want a diverse workplace, all those questions you're asking, I loved it that these women had overcome them, even in some difficult situations. But I think you heard, it made a difference where you were, right? And then you're going to have a session today on negotiating, and that is fantastic because women are notoriously less successful at negotiating than men are. So you're getting that skill today, or you have a session on that, which is fantastic. So this is a link to, I'm showing you here this Women in the Workplace study. It's a fantastic resource. There's another thing that I follow on Facebook or Twitter, which is called the Representation Project. Have any of you heard of that? This is the group that during the Super Bowl, they have people tweet if the ads are ridiculously anti-women. You know how they have the ad of the woman eating that burger, you know, in the bikini. They're actually creating a movement to try to change how the media, you remember that box at the top that said society? They're actually trying to change perspectives around women by sort of using social media to do that. They've got a couple of films that are like, they've won documentary, you know, awards for being best documentary films. And one of them is called The Mask You Live In, and it's about little boys. And the boys, actually men, are sensitive and have feelings until about 8th grade. I don't know if we have any pediatricians in the room, but in about 8th grade, 7th grade, 8th grade is when they start hearing, what's that phrase? Don't act like a girl. Man up. Man up. You're acting like a girl. And that starts about middle school, and the idea that men, you know, that's really difficult. I mean, that's another way of getting at unconscious bias, right? About changing that whole way of thinking. So I recommend all of these sites as a place to learn more. And I think, and this, I'm going to close with this, there are 4 things that we're going to have to do to improve population health, which is really what all of our systems are trying to do now. And to lead in that, there's going to be individual leadership. So you as a leader and how you can develop. That's that box on the left. There's also this notion of how we work together and how we develop teams and how we become more resilient. Then we're going to have to lead differently in organizations. And then finally, I think you're going to find in your careers in medicine, you're going to spend a lot more time with people who work outside of the hospital. People who work in home health agencies, who deliver food, who do home monitoring. Have you even heard of this concept of community paramedicine? Has anyone heard of that word? They're actually using EMTs to go visit patients in their homes to try to reduce readmission rates. If you talk to an EMT, they will tell you they know more about your patient's home life than you do because they've actually been inside their home. And they know if it's dirty, if there's not running water, if they don't, you know. So I think you're going to find more of that. In my view of leadership, there's a lot of different views. I think that leaders are the servant of what is. So how do we maintain what's great about what we're doing, but also the shaper of what might be. And I would think about all of you as future leaders in some way or another. It might not be with a C in front of your name or being a chief. It just might be leading in the sphere of influence in which you operate.